You did it. You did it. You clicked on this video because you want to know a little bit more about first aid out in the bush. That's what we're going to go through in this series. This is the first episode in a 6-part series about first aid while off-road, while you're out exploring, hiking, discovering where the road ends, and you know, enjoying this lifestyle that we all do. A lot of you will know some first aid or know someone who knows a bit of first aid. But look, out here when you're away from civilization, there are a few things you need to consider, and we're going to go through those in this series. Hi, I'm Todd, I'm from Off-Road Crusader, and this is Off-Road First Aid. So for those that haven't been to the channel before, g'day, how you going? This is Off-Road Crusader. This is where we do a heap of stuff off-road, exploring and discovering where the road ends, and of course, modifying a vehicle to get you there and get you home. So a little bit of background about me. I have studied paramedicine. I studied paramedicine with ECU here in Perth. Went through, got my degree, did everything on that range. I've been out and done a lot of off-road stuff. I've been out and been involved with a whole heap of different first aid scenarios, and I feel that I've got a little bit to teach you guys. This is more of a basic sort of like fundamentals, but also a little bit more that you get with someone with a bit more of academic knowledge about the subject, rather than someone who's just spent the last 30 years bandaging someone on a station. So yeah, this has got a little bit more to offer in terms of that sort of content. This series is all about first aid in the bush, all about first aid away from civilization and away from help, basically, where you may need to know a little bit more in order to get through these sort of situations a bit easier and with better outcomes. So first aid itself is the assistance to people who have sudden onset of illness or symptoms. That can be, I've just fallen over and scratched my leg. You know, I've got a stick poking out of my chest. I'm choking on something. I've had an allergic reaction. It's a quick onset, and you need to be there to help them out. First aid is not about diagnosing issues. It's not about long-term care. It is about someone is hurt. I need to help them as best as I can. Basically, package them up in the best way possible. Get them to somewhere or someone who can help them further. So that's the main goal with first aid. It's not all about creating long-term health plans and that sort of stuff. It's there and then, you're there to help. A lot of the times with these first aid things, there's no one else around to help you, especially out in the bush here. Where you're out in, say, a metro area, you might have someone down the street, you might have the co-worker across the hall, someone else who knows a little bit more about first aid than you. And I suppose it makes a lot of people complacent about working on skills and things that you will need to rely on if you're the only person in the room to help. And out here, there's no one else. There's literally no one else around. It's a very, very quiet morning out this way, and just the way I like it. So it's a good morning to go through some of the fundamentals of first aid out in the bush. So the main one, this is one thing which will be the groundwork for everything we talk about on this series, is doctors ABCDE. You may have learnt or read about or come across this in some way, shape or form. It used to just be like DRABC. It has now included some other things and chopped and changed to adapt to more recent knowledge and research, which indicates better ways to go about first aid. So that will be the main framework. And when you come across someone and you're in an emergency situation, you go through that list, DRSABCDE. We're going to go through all those in this video, which basically gives a really good groundwork for every single first aid scenario you will come across. Doctors ABCDE, these are basically a step-by-step process to help you go through and help out a person in need of first aid, in need of help out in the bush, or anywhere really. Out in the bush, there's going to be a number of little things to, I suppose, focus on with these sort of this framework. But all of it is going to be applicable to everything in everyday life. So you're going to work your way down all the way from D through to E, and we're going to go through all those steps now. So the first one, D. D stands for danger. Danger to yourself, the patient, or any bystanders there. You're walking along a bushwalk walking track, you find someone laying down in the middle of the track. Oh no, someone's laying down in the middle of the track. Before you rush in there like the hero you are, take a second and look at the scenario around that person. Is it safe to enter that scene? Do you see that there is a tree that's about to fall on top of them? Do you see a snake that's curled up under their arm? Do you see that they're covered in wasps or bees or something like that? All of these things will indicate whether it's safe for you to enter that scene. There's also other people around you as well. Maybe you see someone who's unconscious, or you see someone laying in a cave or you know, between some rocks or something like that. It's not safe for everyone in your convoy. You may have 20, 30, 40, maybe 5 people, depends how many friends you got, who all want to rush in there and help, and you have to make the decision as the first aid officer to say, nope, it is only safe for one person to enter this scene at the moment, and you go in there and help that person, or whether or not you need to remove that patient from the scenario they're in. So if they're stuck under a tree branch, maybe best to remove the tree branch before you go through all the rest of your first aid stuff. May need that you need to get some people together. Look, this person's fallen off a little rock ledge. It's not safe to help someone down here. Let's grab this person and pull them up towards where we can help them out. Now, obviously, when you're moving a patient, there's a huge range of different things you need to consider there, whether or not it's safe to move the patient, how you're going to move the patient. We will go through some more of these more specific scenarios in upcoming episodes. But yeah, the danger is mainly about seeing whether it's safe for you or the patient or any bystanders to move forward with performing any more first aid. So next up, we've got R. R stands for response. Is the patient responsive? Can you get a response from the patient? This will indicate and will, I suppose, direct how you perform your first aid moving forward. You basically got 3 categories they can fall in. If they're completely responsive, as in they are responding to you as any other normal person would. If they are mildly responsive, means that they may be mentally altered, they may not be able to hear, they may be dizzy, they may be seeing things, having hallucinations, whatever it may be, or whether they're completely unresponsive, whether they're unconscious. What category this person falls into will determine how you progress with your first aid. And obviously, if someone's going to be in this first category where they are completely responsive, you come across someone, hey mate, you all right? And they say, oh, hey, how you going? You know, I think I've just been bitten by a snake. Can you help me out? Cool. Like it has made your job easier, I would say, because you have that other person to talk to and to tell you about the situation. They also may be much more willing to cooperate in terms of moving them to another location or to be able to help them further with first aid. So if someone's mildly responsive, you may think that there is something altering how they're responding to the world. Look, the first one that comes to mind is substances and alcohol. Obviously, when you see someone who's quite drunk, they're going to respond to the world very differently to someone who is completely sober. Same with different substances people may use, maybe also things to do with anything they've eaten. So, for example, mushrooms, if you're hallucinating or there's something going on. It may also be indicative of things like heat stroke or hypothermia, where someone is like their body's basically starting to shut down because of an extreme environment. You're not going to know that until you're in the particular environment you're performing first aid in, but things to keep in mind, especially in an off-road first aid situation. And the last one is unconscious. Someone is not responding in any way. If that's the case, you can talk to them. That's the first thing you do with response is say hello. Hey mate, how you going? Like, can you hear me? Are you okay? No response. Cool, get a little bit closer. The next thing you're going to do is just a light touch. That's just touch on the arm, touch on the shoulder, touch on the leg, just to sort of let that person know you're there. Hey mate, can you hear me? Are you there? What you're looking for here is basically to see if someone's in this second category where they're mildly responsive, because they may, I don't know, maybe they can't hear anything. It may be that they can't see, maybe they're just completely zoned out to wherever their mind might be at that particular moment, and they're not responding to voice. So responding to touch will be another thing. Sometimes I turn around and go, huh? Like, you know, you may sort of snap them out of a bit of a trance they have. Or if they're still not responding, the next one you can try is response through pain. Now, I'm not talking about causing them a dramatic amount of pain. All you're looking to do is cause the patient to have a response to basically more of a firmer touch. So that may be, you know, grab onto your trapezoid muscle up here, give it a squeeze, and even you do it to yourself. You don't have to squeeze hard and you go, oh, you know, I definitely feel that. The other one you can do is squeezing on the fingernail. There's quite a lot of nerve endings underneath your fingernail, and if you squeeze those together, you don't have to do it very hard, but you definitely go, oh, that's a bit firm. You know, that feels, that's not quite painful, but it's quite firm. And how the patient responds to this will again indicate how you should move from here. If they, they have a tiny bit, or they twitch, or they pull away, or something like that, you know that they're still there. They're not completely unconscious, but they are obviously unresponsive to everything going on around them. In which case, any case in this sort of situation, you're going to be very fast and progressive with your first aid and help that person out as much as possible. If they're completely unconscious, that also tells you should hurry up and help them. The next part of this is S, which stands for send for help. You are pretty much always going to do this. There are going to be a number of situations where you go, no, actually, we can deal with this, we'll send for help, or I can help this person out completely. But if you're in a first aid situation where they're very unresponsive, or you're not going to be able to help that person 100% right there and then, send for help. That means you need to get on the horn, you need to call someone, you need to get in contact with emergency services, or with it might be SES or Coast Guard or whatever it may be in your country, and get help coming to you, because help is going to take a little while to get to you. If you're out isolated from civilization, you're in the middle of the bush, you're on an island somewhere, you're off hiking in the mountains, it's going to take a while for help to get to you, and you want to get that ball rolling as quickly as possible. There are a number of ways you can go about doing that. Obviously, if you've got phone reception, nearly everyone has a phone these days, get on the phone, call 000 or 911 or whatever it may be in your country, get help coming to you. Next up, you've got things like UHF communications, or your CB radio, whatever you want to call it. Jump on there, jump on your emergency channels, and call for help, see if you can get any help on there. Otherwise, you've also got things like satellite phones if you carry one, personal locating beacons or PLBs. These devices are something that you can activate in an emergency. It'll send your signal and distress signal to a emergency response team, and they will get on to getting to you and helping you out as quickly as possible. There's also EPIRBs, which are mainly based for like ocean going or naval operations, because they're designed to be very long battery life. They're designed to be buoyant and floating and all this other stuff. So usually if you're on land, carry a PLB. If you're going to be on the water, carry an EPIRB. One thing to note here is if you're sending for help, best not to leave that person who needs help. Try to stay with them if you can, or at least keep them in eyesight. You know, like if I'm here and I've got someone who's laying down, they're really hurt, I may be able to just, look mate, I'm just going to take 20 steps that way and get reception and call for help. Go and do that. Keep the person in your sight. Try not to move the patient if you can, or if you can, send someone else away to call for help, so that you can stay there with the patient. But the sooner you get that ball rolling, the sooner you recognize you need to call for help, do it, and get help coming as quickly as you can. If you've gotten to this step, you have helped the patient out immensely. Obviously, they've been in a situation where they need help. You've arrived, you've assessed their situation, you've then called for help. You've let them know, this patient is unresponsive. This patient is okay, but they've broken their leg. You know, we've got food, we've got water, or, you know, no, we've got absolutely nothing and time's running out and we need quick evac, that sort of thing. You can let response teams know about that sort of thing, but you need to get on early. And by getting to this stage, you have made a huge benefit in the potential outcome for the patient. And I applaud you. If you get that far, good on you, man. So next up is really going to be an assessment of the patient, and seeing about what you can do to help that patient and going through some different things. So you've gone DRS, the next one is A for airway. If that patient has an open airway, or what they call a patent airway, patent basically means that it's completely operational. So you can breathe through it, there's nothing clogging it up, it's not full of mucus or blood or anything like that, and it's not swollen, and that person can use their airway and they have the capacity to breathe. You need to help that patient out as best you can. The best way to do this, if you don't think their airway is patent or they're able to use it, get the patient down, lay them on their side in the recovery position. So they're going to lay on their side, their head's going to be slightly tilted down. This will slightly open the neck a little bit. You're then also going to lift the forehead back slightly and pull down on the jaw. You're going to open up that airway as best you can. Anything that is in that patient's airway can drain out. It's got gravity and it's assisted to help out. If you can scoop anything out, you see anything such as maybe vomit or food or blood or anything else that's stopping that airway, just use 2 fingers and sort of scoop out that airway, see what you can get out of there. Don't go pushing things down into their mouth to try and get things out, just whatever you can physically see. Anything further down, you're going to try and grab it and you're going to force it further down, so don't bother. Now, if this patient is talking to you, if you can see they're breathing on their own, you can safely assume that their airway is in good condition. It's able to be used, it's patent, and you can move forward from there. If obviously the patient is unresponsive, that's when you move forward to going into your recovery position to help out their airway. Next up, breathing. Patient needs to be able to breathe. Everyone needs to be able to breathe, which you can't do without an open airway. So this is why everything's got this clear order. Make sure their airway is open and then make sure they can breathe. If you make sure they can breathe but their airway isn't open, then you're not going to get anywhere. So you're going down to breathing. There's not a huge amount that as a bystander that you'll be able to help with breathing, but a lot of it will be in just assisting the person to breathe easier. They may be little things, listening to how the patient's breathing. How are they breathing? Is it short and rapid and which may be indicating a huge amount of stress. It may be indicating that they've got a lot of adrenaline running through their body at the moment, and they may need to calm down a little bit. Or if maybe it's quite deep and shallow and laboured, you know, they're really like they're working hard. It'll be indicating exhaustion, a lot of stress. That may be indicating heat exhaustion, heat stroke, or hypothermia, depending on what sort of environment you're in. The breathing will also be altered depending on how the body's responding to stress. So you'll start to go into things like shock, which is something that we'll cover in a later episode. But listening to how a person's breathing, and even just sort of coaching them through, you know, taking some deep breaths, slow down, it's okay, I've got you. And you'll notice that once the patient's breathing sort of starts to improve and you go, yep, they're breathing much more normally now, then you can move forward from there. It's also something you can make note to the responders when they do arrive on scene. Hey, when I first came across this patient, he was labouring, his breathing was very laboured, he was breathing very slowly, and but now that I've sort of relaxed him, he's breathing much better. Or the patient was breathing really, really rapidly, I've tried to calm them down, but it's still not helping, they're still breathing really rapidly. That will allow first responders to treat that patient even better because they have a bit of a history of how the patient's been in that time frame, as opposed to having absolutely no idea from someone who's also sitting there and shaking their head and screaming and going, I don't know what to do. You know what to do. You're watching this video and you're learning things. Now C stands for circulation, obviously blood in the body, where you want it to be. You're going to go through all these things and you're going to get down to circulation. So once they're breathing, they're doing pretty well. The circulatory system has a lot of ways to correct itself if it's not as it should be. It has a lot of systems in place where if your blood pressure is too high or too low, your pulse goes up or down, whatever it may be, there's a lot of systems in the body that can take over and can self-correct that. Once it gets to a point where they don't help, obviously you need further intervention, and obviously the situation may be a little bit more dire. But this is something, that's why it comes down under breathing, because if you're not breathing, things go south very, very quickly. But if you've got a high pulse rate, you can survive with that for a very long time, or much longer than you can if you're not breathing. So that's why it's placed down under breathing. So there's not a lot of things you can do as a bystander primarily as an intervention for circulation, but there will be a few things you can help out and just take note of things as well. Things like their pulse. So take the person's pulse. Easiest way to do that is, or the most least intrusive way, is on their wrist. So you'll find the radial pulse. If you follow your thumb down and you come under here, you'll feel there's a bunch of tendons and things there. There's this little soft spot on the side. You'll feel it's like almost like a dimple, or like a depression in the skin when the wrist is out like this. You're going to go there, use 2 fingers. Don't use your thumb. There's a pulse in the end of your thumb and it will confuse the hell out of you. Use 2 fingers. You're going to put them in that little void and you're just going to hold that there, and you will be able to feel a little pulse. You'll feel that it's very strong or very weak. You'll feel how rapid it is. If you can, count out what the pulse is. So you're looking for beats per minute. How many of those little pulses you can feel in a minute. Either count to 60, count to 30 and times by 2. Count to 10 times by 6, or count to 6 and times by 10. That's usually what I do, is I'll hold that down, I'll count to 6, make a mental note of how many little bumps I felt, and once I say, oh yeah, you know, that was 7 bumps in 6 seconds, cool, times that by 10, cool, 70 beats per minute is a good way to sort of approximate that. It's never going to be 100% accurate. The most accurate way is obviously to count to 60, in which case you'll get a much more closer number to where it is. But sometimes you don't have to sit there for 60 seconds trying to hold a pulse, especially if the patient is in a scenario where they don't want to sit still, or you can't sit still, or you need to hurry. Whatever you feel comfortable doing, and whatever level of math you're comfortable of doing quickly in an emergency situation as well. If you can't find a pulse there, the next one up is to grab your carotid pulse. So up here, you're going to go to the windpipe in the center there and slightly off to the side. Basically fall around until you get to where the windpipe sort of comes down, and you're going to get to the edge and it starts to plateau. In there, a little bit of pressure, and there it is. You're going to find your pulse in there as well. Usually this will be much stronger. There's a lot more blood flowing up your neck than there is right out to your wrist. So that's always a good spot to find it as well. If you can't find a pulse on the wrist, your radial pulse, look for your brachial pulse. So that's in here, basically in the dip of your elbow, or whatever you want to call it. That's where you'll find another pulse as well. I don't like trying to find one here because it tends, like a lot of patients, if they're in stress, they try to curl up, there's a lot going on. You don't want someone to have to hold their arm out for a long period of time. Also, you tend to get a lot of dirt and sweat build up in here, which can hinder getting a pulse from in here. But it's a good way to check if you've got a pulse in the arm versus in the hand. So this may be more indicative of things like large cuts, hemorrhage, a lot of bleeding, where if they've got, you know, big cut on their finger, if you haven't got a pulse in the wrist, but you've got one in the arm here, that's something to make note of as well. And you can then go forward with future first aid. We'll talk about a lot of this in upcoming videos of where this becomes necessary. So D stands for defibrillator. Now, a defibrillator is an electronic device which can help to monitor a patient and to deliver electric shocks to jumpstart the heart, which obviously is required in like a CPR sort of situation. If someone's got a snake bite or they've hurt themselves, you know, fallen off a ledge, they may not need a defib, but it's always good if it's around, attach it, get it on the chest. It'll monitor, it will keep an eye on their heart rate, things like your breathing as well, some of them will do. And that'll obviously help a lot with emergency crews when they do arrive, if they've already got a defib attached and ready to go. All defibs are different. When you get one, or if you have one available, make sure you have training on it, what buttons do what, where the pads are going to go on the chest, what to do if you don't get a signal, all these sort of things. Make sure you're up to date and ready to go on that particular defib. Most defibs will make it very easy to use them. So if you come across one and you really need one, they should have instructions on it or diagrams to quickly figure it out, but it's always good to know a lot more information firsthand. Now, the last one on this list is E. E stands for extraction or evacuation, whatever you want to call it. That's basically how you're going to get from here to wherever this patient needs to go to get further help. That may be a hospital or the doctor's office or wherever it may be. How are you going to do that? You need to make a bit of a plan for how you're going to do this. If it's just you and a patient, obviously things are going to be a little bit more difficult. Whether or not you need to stay there. You may need to go, no, we're in the middle of the bush, this patient can't walk, but we need to stay put. Make that call there and then. Okay, this person's sprained their ankle, I need to help them to get back to a car so I can take them to hospital, whatever it may be. Or I'm expecting a helicopter to come and appear. Maybe let's go and clear a space over there, or you know, get the patient to a spot where a helicopter can get to us. Little things like that, or getting to a landmark. Thinking about how you're going to get out of this situation. Obviously, you're not going to be thinking about this when the patient has a restricted airway. Fix that first, work your way down the list until you get to extraction. Once you're at extraction, you've done the best you can, you've monitored that patient, and they're ready to get out of there and find help. So that's pretty much the framework. DRSABCDE. Work your way through all those letters. That's basically a good framework to work through with any first aid situation, and will help out the patient immensely. So the last thing I wanted to cover on this video is consent. Now, this is something, I remember reading a study somewhere, I can't remember, if I find it, I'll put it on the screen, otherwise I can't remember exactly where I saw it. But a big reason some people don't get involved with first aid is they're scared of being sued, or for people not wanting first aid, or for whatever it may be, you being then made responsible or liable if that person then goes downhill despite all of your interventions. And people get scared of that, and they go, I don't want to get involved just in case, you know, things happen for me down the track. That's when you need to look at things like consent. Does that patient want you to help them? Now, there's two different forms of consent here. One is informed consent, or given consent, as you may call it. So that's basically the patient is awake, alert. They're looking at you and they say, please help me. Can I help you, sir? Yep, yeah, please help. Whatever you need, please help me out. They've given their consent for you to help that patient out. They can also not give their consent. They may have fallen down a cliff and they're not comfortable having you there to help them out. They say, no, I don't want your help. Go away, just call for help. I don't want you here. That's their call to make. They can consent to who they want to touch them and help them out in this situation. You're a good Samaritan, but you're not going to go against someone's wishes if they're saying, don't touch me, and you're like, nope, I know my first aid, and you start bandaging them up, and all they want is just to be left alone. Please respect their decision. If they decide they don't want help, you can hang around and say, mate, okay, you don't want my help, I'm going to be here, what do you need? Can I call for help for you? You don't have to physically touch them, but you can be there to help. Now, the other one is implied consent. Now, this is where the patient is unconscious. You find someone, they are completely unresponsive on the ground. Do you help them or not? In Australia, we have something called the Good Samaritan Law, which basically covers you in this situation. If that person then wakes up in hospital and says, no, I didn't want to be treated, you're okay. You're not liable at all because you've acted as a Good Samaritan. You've seen that that person needs help. they've implied by being unresponsive that they require help, and you go through and help them as best you can. Now, obviously there's limits to this. You can't just say, oh, someone's unconscious, I can do whatever I want with them, but you need to be as respectful as possible. And that may be, okay, look, I need to get a look at their wound. Doesn't mean completely ripping their clothes off and letting everyone look at them. It just means that you do it as respectfully and nicely as possible. So that's implied consent if they're unconscious. Now, there is a grey area in all this, and that is when someone is in a altered mental state. So whether or not they are under the influence of substances or alcohol, or maybe they're delirious from heat stroke or from hypothermia, they're going to go away, get away from me, and you can see they need help. You say, mate, you need help, let me help you. And they don't want help. They're in a state of panic and they don't want anyone around. If you find someone in this situation, don't get hands-on about it. The first thing you can do if you find someone like that is call for help, is look at that person if they're in danger, and if you can steer them or, you know, keep a snake away or whatever it may be from getting to that person who's delirious and in an altered mental state, then help out that way. Be as indirect in your help as you can. Call for help, obviously call for an ambulance, call for rescue crews, because you can see that patient is going downhill. A lot of people who are in an altered conscious state and they're in an emergency situation will need help. They are going to decline in their condition and they are going to require first aid. In that case, don't just go, oh, I'll call you an ambulance, mate, have a good night, catch you later. Hang around, because they may fall unconscious. They may do something silly like knock their head against a wall and fall unconscious. And you need to be there to help them for that. Once they are unconscious, you can assume implied consent and help that patient out as best you can. You know that if they were awake, they don't want help. So don't go changing their whole environment and you know, stripping their clothes off and doing all X, Y, and Z. Try to be as least invasive as possible with your help in that kind of situation. I think it's very important to know about these sort of consent rules, especially if this is something that you're concerned about, either legally or financially or whatever it may be, for repercussion of trying to help someone in need of first aid. If you get in there and help someone, and you can do the first 3 steps of all of this without even touching the patient. You can rock up, you can see if that person's in danger, you can check their response, you can send for help. You can do all that and not even touch the patient. If you get to that stage, you can call for help, away you go. If you need to go through and help that patient all the way through these sort of steps, then you're helping them out a hell of a lot further as well. But you getting there, doing those danger, response, send for help, is going to go a huge way in that patient's outcome. So guys, thank you very much for watching. I hope you've learned something from this episode, going over the fundamentals for off-road first aid. Everything we've talked about so far is going to be a bit of a groundwork to ongoing episodes, going into more specific things that we're going to be looking at, like certain scenarios or gear you should take or what you shouldn't use, or even we're going to be looking at some CPR situations. Obviously, first aid information is evolving all the time. What we all believe to be the best thing to do in a first aid situation 50, 100 years ago obviously has changed, and that change and evolution of information and medical knowledge has rapidly advanced, and you will find that a number of things in 6 months, a year, 2 years, 5 years will be completely different from what we know now. So obviously just use your initiative, use your common sense, and if you need to get advice from other medical professionals as well before you head bush to look at some more specific scenarios you may be involved with, depending on the environment you plan to travel and explore in, whether that be in the bush or out at the beach or on the ocean, maybe in Antarctica, or it may be out in the desert. But seek knowledge from those who know those specific areas very well, complement it with this general knowledge that I'm teaching you, and you will be very much set up and in a much better situation to handle first aid situations should you come across them. So please comment down below if you've learned something from this episode, if there's a particular scenario or any skills that you'd like me to go through and show on these sort of episodes, and I'll catch you next time on Off-Road First Aid with Off-Road Crusader. Cheers guys, have a good one.